During the medicine round, you can't find Mr. Smith to give him his tablets. You find him in the bath, and he asks you to leave them on the table next to his clothes in the bathroom. What is your next action?
If I were unable to find Mr. Smith during the medicine round and later located him in the bathroom, I would first ensure his privacy and dignity while addressing the medication administration safely. Upon his request to leave the tablets on the table next to his clothes, I would explain to him that, for safety and policy reasons, I cannot leave medication unattended. Instead, I would reassure him that I would return once he had finished in the bathroom to personally administer his medication. I would take this opportunity to discuss the potential risks associated with leaving medication unattended, such as accidental ingestion by another patient, loss of medication, or possible alterations that could compromise its safety and efficacy. If Mr. Smith expresses concern or reluctance, I would address any issues he may have, ensuring he understands that my primary goal is his safety and well-being. Additionally, I would document the situation appropriately, noting that the medication was not administered at the initial time due to the patient being in the bathroom and that I would return to complete the process. If necessary, I would also communicate with the wider healthcare team to ensure continuity of care and adherence to medication safety protocols.
It's 6 a.m., and your colleague is off the ward on her break. An acutely ill patient has just arrived in the ward following surgery, and a patient has just fallen out of bed. What is your next action?
At 6 a.m., while my colleague is on break, I am faced with two critical situations: an acutely ill post-surgical patient arriving on the ward and another patient who has fallen out of bed. Prioritization and effective communication are essential in this scenario to ensure both patients receive appropriate and timely care. My immediate priority is to assess the condition of the patient who has fallen. I would quickly check for any signs of collapse, injury, or distress while ensuring they are as comfortable as possible. Moving the patient without proper assistance could cause further harm, so I would not attempt to lift them back into bed until help arrives. Instead, I would provide reassurance and conduct an initial set of vital signs to determine their stability. Simultaneously, I would call for assistance, either from nearby colleagues or, if necessary, by contacting my colleague on break. If additional help is required, I would escalate the situation to ensure adequate staffing support. I would then notify the medical team so that a full assessment of the fallen patient can be carried out promptly. Once the patient's immediate needs are addressed, I would ensure the acutely ill post-surgical patient is attended to, coordinating with the appropriate team members to facilitate their safe admission and monitoring. Finally, after both patients are stabilized and their care has been appropriately handed over, I would document the fall incident thoroughly in the incident report, ensuring that all necessary follow-ups, including any preventive measures, are taken to enhance patient safety on the ward.
What are your strengths and weaknesses?
One of my key strengths as a surgical nurse is my ability to remain calm and focused under pressure. Working in a high-stakes environment requires quick decision-making, and I am confident in my ability to assess situations rapidly and respond effectively, whether it involves handling post-operative complications, prioritizing patient care, or managing multiple tasks simultaneously. I am also highly organized and detail-oriented, ensuring that medication administration, surgical site monitoring, and patient documentation are accurate and thorough. Additionally, my strong communication skills allow me to work collaboratively with the multidisciplinary team while providing clear explanations and reassurance to patients and their families during what can often be a stressful time for them. As for weaknesses, I sometimes find it challenging to delegate tasks because I take great responsibility for patient outcomes and want to ensure everything is done correctly. However, I recognize that teamwork is essential in nursing, and I have been actively working on improving my ability to trust colleagues with appropriate tasks to enhance overall efficiency and patient care. I also tend to be highly self-critical, always striving to improve my performance. While this drives me to continuously learn and refine my skills, I am learning to balance self-improvement with recognizing my achievements and maintaining a healthy work-life balance.
How would you support an HCSW who is new to healthcare and starting on your ward?
If a healthcare support worker, HCSW, who is new to healthcare joins my ward, I would begin by giving them a warm welcome and introducing them to the team. A supportive and friendly environment is essential in helping new staff feel comfortable and confident in their role. I would take the time to explain the ward structure, key personnel, and daily routines to help them understand how the team functions. To ensure they feel properly oriented, I would give them a tour of the ward and relevant departments, such as the medication room, storage areas, and emergency equipment locations, as well as introduce them to key teams they may need to collaborate with, such as physiotherapists, doctors, and the wider nursing staff. Understanding the layout of the hospital is crucial to helping them navigate their role more efficiently. I would encourage them to ask questions and remind them that no question is too small. Starting in healthcare can be overwhelming, so I would promote an open and supportive culture where they feel comfortable seeking guidance. I would also emphasize the importance of asking for help when needed, reassuring them that teamwork is essential in providing safe and effective patient care. Building a good working relationship is also key to their confidence and success. I would treat them with respect, provide constructive feedback, and acknowledge their efforts. By fostering a positive and inclusive environment, I would aim to support their growth and help them feel like a valued member of the team. Regular check-ins and mentorship would further reinforce their learning and development, ensuring they have the necessary support to excel in their role.
You're on a night shift, and it is understaffed. You're doing the drug round, and a patient's prescription chart does not look right to you. What would you do?
During a night shift, especially when understaffed, patient safety remains the top priority. If I come across a prescription chart that does not look right, I would pause before administering any medication and carefully review the prescription to identify the concern. This could include an incorrect dose, a potential drug interaction, an unclear instruction, or a missing signature from the prescribing doctor. I would then cross-check the patient's medical records and previous medication history to see if there is any clarification available. If the discrepancy remains unclear, I would immediately escalate the concern by contacting the prescribing doctor or the on-call medical team to verify the prescription before proceeding. It is crucial to ensure that the medication is safe and appropriate for the patient rather than risk administering something that could cause harm. Additionally, I would inform the nurse in charge of the ward so that they are aware of the issue, and I would document my actions appropriately, including any communications with the doctor and any changes made to the prescription. Even during an understaffed shift, it is essential to adhere to safe medication administration protocols, as patient safety should never be compromised due to workload pressures.
You observe your patient laughing with his visitors. When you approach him, he is complaining of pain and asking for analgesia. What would you do and why?
If I observe a patient laughing and engaging with visitors but then complaining of pain and requesting analgesia when I approach, I would respond with a professional and non-judgmental approach. Pain is a subjective experience, and individuals express and tolerate it differently. Some patients may attempt to mask their discomfort in social situations, while others may have fluctuating pain levels. First, I would assess the patient's pain using an appropriate pain assessment tool, considering factors such as location, severity, type of pain, e.g., sharp, dull, throbbing, and any aggravating or relieving factors. I would also check their medical records and medication administration charts to review when their last dose of analgesia was given and whether they are due for another dose. If the patient is within the safe time frame for their next dose and there are no contraindications, I would administer the prescribed analgesia and monitor their response. However, if their pain level seems inconsistent with their condition, or if they are frequently requesting analgesia beyond what is expected, I would consider other factors, such as inadequate pain management, potential medication dependence, or underlying psychological or social influences. In such cases, I would escalate my concerns to the medical team for further evaluation and possible adjustment of their pain management plan. Regardless of the situation, would ensure that the patient feels heard and supported, reinforcing that effective pain relief is a priority while maintaining professional judgment and adherence to safe medication practices.
Tell us about a time when you were unable to do what you said you would.
There was a time during a particularly busy shift when I assured a patient that I would return within 15 minutes to assist them with personal care. However, shortly after, I was called to an emergency situation involving another patient who had deteriorated rapidly and required immediate intervention. Given the urgency, I had to prioritize the critical patient's care, which delayed my ability to fulfill my initial commitment. Once the emergency was under control, I immediately went back to the first patient, apologized sincerely for the delay, and explained the situation. I reassured them that their needs were still important and proceeded to assist them as soon as possible. Fortunately, the patient was understanding, and I made sure to communicate more effectively moving forward, keeping patients informed of any delays and seeking assistance from colleagues when necessary to ensure that all patient needs were met in a timely manner. This experience reinforced the importance of time management, prioritization, and clear communication with patients. It also highlighted the value of teamwork in ensuring that patient care remains consistent, even during challenging situations.
You check the observations for a patient who has presented with confusion and find the following RR30, HR125, BP 90/50ths, SATs 94% RA, T39.8.
Upon reviewing these observations, would immediately recognize that the patient is showing signs of potential sepsis or another serious underlying condition requiring urgent intervention. The combination of a high respiratory rate, 30, tachycardia, HR125, hypotension, BP 90/50ths, and a high temperature, 39.8 degrees Celsius, suggests a systemic infection, while the confusion may indicate worsening sepsis or inadequate perfusion to the brain. My immediate priority would be to escalate the situation by alerting the nurse in charge and the medical team, as this patient requires urgent assessment. I would ensure the patient is in a safe position, provide reassurance, and closely monitor their condition while preparing for further interventions. Given their low blood pressure and high respiratory rate, I would consider placing the patient in a high observation area and ensuring access to oxygen if their condition deteriorates. I would also anticipate the next steps, such as obtaining intravenous, access for blood tests, including blood cultures, a full blood count, and lactate levels, as well as the administration of 4 fluids and antibiotics as part of the Sepsis 6 protocol. If the patient's oxygen saturation were to drop further, I would provide supplemental oxygen as needed and continue monitoring vital signs closely. Finally, I would document all findings and actions taken in the patient's notes to ensure clear communication with the wider healthcare team and support timely, effective treatment. Prompt recognition and intervention are crucial in preventing deterioration and improving patient outcomes.
Mr. Smith is a 65-year-old gentleman who has been diagnosed with bowel cancer. He is complaining of increasing abdominal pain and nausea. What actions would you take?
If Mr. Smith, a 65-year-old gentleman with a diagnosis of bowel cancer, is experiencing increasing abdominal pain and nausea, my first action would be to conduct a thorough assessment to determine the severity of his symptoms and identify any potential complications. I would begin by checking his vital signs, including respiratory rate, heart rate, blood pressure, temperature, and oxygen saturation, to assess for any signs of deterioration, such as sepsis, obstruction, or perforation. Additionally, I would evaluate his pain using an appropriate pain assessment tool and assess his nausea severity, asking about any associated symptoms like vomiting, bloating, or changes in bowel habits. If Mr. Smith has been prescribed analgesia and antiemetics, I would administer them as appropriate, ensuring they are within safe limits. If his current pain management regimen is insufficient, I would escalate my concerns to the medical team to review and potentially adjust his analgesic plan, especially considering the need for stronger pain relief such as opioids if indicated. Given his bowel cancer diagnosis, I would also be vigilant for complications such as bowel obstruction. If I suspect obstruction, evidenced by worsening pain, abdominal distension, absence of bowel movements, or worsening nausea, I would escalate the case urgently to the medical team for further investigation and potential intervention, such as imaging or surgical review. Throughout the process, I would provide reassurance to Mr. Smith, ensure he is comfortable, and offer non-pharmacological interventions such as adjusting his position or using relaxation techniques. I would also keep his family informed, as appropriate, and document all assessments, interventions, and communications clearly in his medical records to ensure continuity of care.